Welcome everyone. Thanks for rocking with us all day long. This is the last session, and then you guys get to eat and imbibe if you do that. And then also we get to hear from Mustafa Ali. But before that, we are joined here and very gracious to be joined here by Dr. Astrid Caldas, Dr. Alexander Wooten, and Mr. Omega Wilson, who ducked out, but he'll be back. So today's session is about the effective models of community engagement to address environmental justice and health issues. So what are we talking about when we say effective models? By saying effective models, there's by default, that means there's an ineffective model. And so this session is talking about some of the both sides of that coin, the right way and the wrong way, lessons learned, success stories, failures. And so we are really, really lucky to have with us professionals in the field and a community member in the field who have years of experience working with communities and going through these processes, failing fast, having some successes, or probably hopefully mostly successes or meaningful successes. So with that, we're going to start with Dr. Caldas, and when Omega joins us, he'll just slip in, I hope.
Much better. Do I need to be close to the microphone now? Okay? All right. So I'm going to start by saying that this is not my project. The Union of Concerned Scientists was a collaborator for this project that came into the project halfway through it, and we had a small role, but important role in it. So what I am going to do, because this is not my beach, and it's not my usual language, I'm going to follow a very good script here, so bear with me. I'm going to read a lot of the remarks, because I don't want to screw it up. So, the research I will present today is part of the Deal Island Peninsula Project, a partnership to support communities in coastal environments in the midst of change, particularly climate change. It has various Is it on automatic something? It has various collaborative research and community projects, and the Engaging Faith Communities for Coastal Resilience is one of them. And I'll be presenting for the lead researchers, Christine Miller-Hesed, Liz Vandola, and Michael Pauliso. In the United States, rural coastal lands are home to nearly 9.5 million people and are culturally and ecologically diverse. They are also particularly vulnerable to the impacts of climate change. While these areas have less infrastructure at risk from climate change, their ecosystems and social, economic, and cultural well-being nevertheless face substantial risks. It is imperative that these rural areas are not overlooked in climate adaptation planning and policymaking. However, engaging rural communities in adaptation discussions is challenging. The absence of municipal governments particularly limits channels of communication and resource distribution to these areas. Churches might offer a structure to improve the communication channels because they are widely distributed in rural coastal areas, are used by residents both privileged and disadvantaged, are intimately familiar with community needs and local environmental challenges, and last but not least, are trusted social entities. I'll speak a lot less in the next slide, so shouldn't move too fast. The hypothesis that was worked on this project was that rural coastal resilience to climate change could be enhanced by creating opportunities for government officials, managers, planners, decision makers, technical service providers, to interact with rural churches through collaborative learning, a process that enables everyone to teach and learn from each other. Collaborative learning has many benefits, such as improvement of knowledge and trust, and the engagement and empowerment of stakeholders, leading to discussions and actions to actively shape the community's future. Got it? It does not come without challenges, though. Social hierarchies, institutional and language barriers are among the main issues that can make it hard to find common ground and solutions. And the issue of climate change itself is not without controversy. But without that in mind, beginning in March 2018, members from 12 rural churches were recruited to participate in the project. 11 United Methodist churches and 1 independent church. 5 of these are African American churches. The project also includes members of Wicomico Interfaith Partners and government officials from Dorchester, Wicomico, and Somerset counties, and the state of Maryland's Department of Natural Resources, Department of the Environment, and Department of Planning. The effectiveness of the collaborative learning process was assessed using both qualitative and quantitative methods. Interviews and audio recordings from collaborative meetings were transcribed and qualitatively analyzed for common themes of concern. Topics and themes were selected by communities then to be discussed in meetings. Following a final project workshop in March 2019, just 2 months ago, quantitative analysis is being conducted on responses to the same pre and post questionnaire. They applied it in the beginning and they applied the same questionnaire at the end. And this will allow assessment of the extent to which cultural knowledge may have shifted during the course of the collaborative learning activities, and whether greater social networks exist between participating church members and government officials. And I'm going to go back here just so that it stays a little longer.
Go back one slide. What were the issues for Wicomico and Dorchester? These are all.
Please.
Okay, all right.
Dorchester chose to marsh encroachment and flooding at the new revived church, which is in Smithville, on Smithville Road. Wicomico County was exploring opportunities for churches and government to work together on environmental challenges. They had a lot going on. As in Somerset County, discussed the role of faith and religion for these challenges and understand. So you can see that the communities picked very different aspects of the issue to be discussed. The New Revived Church is a very old church from this town, Smithville, which now has only, I think, 3 houses and 3 families that still live there. It used to be a much bigger and larger community, but people started leaving. But they still come together at that church every Sunday for services. So the marsh is encroaching through the back, and it's right at the back of the church by now. And there is a cemetery on the grounds that is being regularly flooded. It used to be just because of storms, but now because of sea level rise and high tides, it floods regularly. So the issue is very complicated because it's hard to put a wall when the water is seeping from underneath. So they're evaluating several different perspectives on how to preserve the history, if not the cemetery physically itself. So halfway through the community meetings, that's when the Union of Concerned Scientists came in as a collaborator. Our role was to bring some of the sea level rise science behind for these communities. The main lesson behind this step is that the anthropology research team found that the community was ready to receive that information at that point and discuss it in the context of their faith and their concerns. This is a huge development because one of the main points when you talk about science communication is to really communicate not only the science, but make it relevant to the audience that you're talking to. So what the audience, what the community is going to do with our information is essential for us to know what we need to pass on to them. So we chose to use a story map showing all the United Methodist churches on the Eastern Shore. And the ones that are in red are the ones that are at risk of flooding from high tide alone. This is no storm, this is no hurricane, it's just a high tide. At different times in the future, 2035 and 2060, with an intermediate sea level rise scenario. It's a very conservative scenario. It's not the scenario we are on right now. The scenario we're on right now is the high scenario, which has a projection of 6 feet by the end of the century of sea level rise. So we showed all that, all the churches and the ones at risk at different time frames and different sea level rise scenarios. And we also put some tabs showing policies, laws, and regulations that restrict activities that they can do to prevent erosion and flooding on their properties. Because these communities are very old, they are very, very knowledgeable of their environments, and they are very hardworking people. A lot of them are fishermen, and they say, I know my environment, I know what I need to do, but the government is keeping my hands tied because I cannot do this, I cannot do that, because they say I can't. So there's a lot of stuff going on. So we put on tabs there showing the wetlands migration regulations, showing what they can do to build a wall or not, what locations they can have hard infrastructure and soft infrastructure. So there's a lot in that story map that would help them deal with sea level rise, flooding, and erosion. And also how to adapt, how to mitigate the risk, as they say in floodplain manager lingo, what they can do to elevate their houses, where they can look for grants, where they can look for resources. And we also provided names of people for them to contact at different agencies so that they could be more informed. So for the final, in the final workshop, a series of capacities and limitations of the different stakeholder groups from the project were identified. While churches provide spiritual and emotional support and guidance in terms of hardship and are motivated to take action to support their communities with needs and concerns, they can be held back due to the lack of experience dealing with environmental issues, as well as changing demographics and isolation. Governments were found to be highly motivated to share information and resources with the communities and have the opportunity to access financial resources and actively plan for long-term environmental changes. But they have a hard time bridging different perspectives and overcoming structural constraints in addressing a challenge of this magnitude. Finally, universities and NGOs, the Union of Concerned Scientists, the Nature Conservancy, and other organizations were there participating in the process. The universities and NGOs have a big advantage in their expertise and focus in addressing and finding solutions for specific environmental issues. But of course, they are hindered by funding and capacity, not to mention the time frame of efforts that may be needed to address those issues. So in conclusion, working with rural communities to address climate change can be challenging due to historic friction with government and the perception of scientists as outsider know-it-alls and patronizing. In the case of faith communities, there is also the perception of scientists above God, which is very negative. That's the first thing they say, oh, you're a scientist, science is not above God. Science is not gonna tell us what God knows, God is, we're in the hands of God. And we have to bridge that, and at the end of the project, it was very gratifying that it changed from scientists cannot know what's going to happen because it's in the hands of God to God gave us scientists to tell us what we can do and how we can protect ourselves. And that was it was huge. It was really, really very gratifying. But that was all because of the conversations that were happening. So the fact that the churches are trusted institutions make them ideal points for a community to come together and discuss common concerns. This engagement is a two-way opportunity for learning, building knowledge and trust in a collaborative way, which requires time and effort, but leads to a stronger network that can support a more resilient rural coast. And I'd like to end by saying that this project was only possible because of the trust that existed between the anthropologists and the community. Michael Pauliso, he bought a home in the Deal Island area, and he started interacting with the community there as a resident. And they started discussing common issues of erosion, of sea level rise, of livelihoods, of people leaving. The young people are leaving, only the older people are remaining there. So for years, they started talking, and years, literally like 4 or 5 years. And with that trust and that, community building, he was part of the community, and he started talking about, it might be a good idea to bring some government officials here to talk about these issues, and maybe we have some options. And that's how it started. And then bringing us with the science, was a step further. So, but that was all based on the trust. So whenever we work with the community, building the trust and knowing what the community needs, what their concerns are, and what they're going to do with the information that you're going to be giving them is the main thing for a successful partnership. So thank you very much. And one last thing is that the communities on the Eastern Shore have a high percentage of the population below the national poverty line. And many of them have 50% of more people from minorities, including a lot of African Americans and a lot of Latinos now. Easton has like incredible amount of Latinos these days. So there is this, they are forgotten. People don't hear about it on the Eastern Shore. They just, they flooded. They're second only to Louisiana in loss of land due to sea level rise. But people don't hear about it because, they're rural, they are poor, they are, so we're trying to bring some light to. Thank you.
Come on in. Thank you, Dr. Caldas. I forgot to let everyone know. So Dr. Caldas is a senior climate scientist or climate analyst at the Union of Concerned Scientists. So now we're going to, I always feel like in these panels, you have to forgive me because I might be a little drunk with power here. This is my first time moderating a session. I always feel
And I have handouts.
Oh, excellent.
Oh, great. The materials.
And Dr. Caldas and Dr. Wooten as well. And as I think Omega are open to sharing their presentations. Yeah,
Yes.
of course. So I always like to, when you see the presentation and then the next one comes, you have a question and you maybe lose it. So I'd like to open up questions now specifically for Dr. Caldas, and then I'll do the same thing with Dr. Wooten, and at the end with Omega, then we can kind of do those cross-cutting questions. And then also too, I feel like other panelists like to question each other. So now the floor is open.
I'm Reiner. I work for Interfaith Partners from Chesapeake, and we work with faith communities to educate them about water issues and watershed literacy and justice. And we've been just starting to work in the Eastern Shore, and one of the things I'd like to highly recommend is a video called Rising Tide in Dorchester. Forgive me, his name was a journalist for the Baltimore Sun.
Bob Horton.
Yeah, Tom Horton narrates it, and standing waist high in his childhood baseball field, standing waist high in water now. But one of the things, people are already putting their houses up on stilts to basically adapt to the rising tide. What was interesting that's revealed in this film is that the languaging is that most people would not, I'm curious if this shifted, most people would not accept an opening conversation about climate change, but rising tide, yeah, that's happening.
Yes.
But actually to make the connection between the cause and the result really wasn't happening. And before I hear your answer, which I'd love to hear, is also about 10 or 15 years ago, there was also an anthropologist who studied Smith Island, and you can see a film of the results of her work, in which faith language actually shifted the consciousness of the people when they were told they had to reduce their fishing catch that was being implemented by the state and the Chesapeake Bay Foundation. They said, no, we're not going to reduce our income. But when the anthropologist lived and worked with them a while and then led a Bible study about stewardship of the earth and God's creation and these waters and the future generations, then they started shifting their consciousness about how to do that. So I'm curious about the languaging and how that was received.
They do not in the beginning, they did not talk about climate change. It was all erosion. That's the thing, erosion. That's all they talked about. And then it's like do you see the tide is higher? Well, maybe, but the main thing is erosion. Well, why is there more erosion? You know, if your land is higher, and why is there? Oh, because the water is coming farther. You know, so there's all these things that you have to start the conversation, and then you start talking about other impacts of how other things are also changing. The rain patterns are changing. The hurricanes are stronger. And you start talking about all these things, and you say, see, the world is really changing. What have you seen change? And then they tell you a little more. So that brings together the conversation, and then you kind of zero in on common ground. In the end, at the final workshop, climate change, all over the place, climate change. And then they are like, well, we were here in this workshop and we worked with you. How do we bring word of this to the rest of our community? How a lot of people don't know about this. And that's what we're in the process of doing now. The UCS is going to kind of take the lead with the outreach with the communities, and they're going to start bringing different groups, public health, fire and emergency departments, other faith groups, librarians, schools. So we're planning to kind of start distributing a little more of the information.
Excellent.
Thank you for your presentation. So I'm actually a faculty member at the University of London School of Medicine, but I actually had the privilege of working with Dr. Holt here. Well, she's not now. She partners with African American churches to present cancer education. One thing that I like that's quite unique about her model is she has sort of the train-the-trainer model. So It's not just the academics teaching about cancer education, but there's lay persons within the congregation who's getting the information, and then they report back, and it's really rich discussion. And so I was wondering, within this model, you mentioned a lot of people coming in, but is there also sort of that capacity building?
When the question was brought up about, we know because we've come to these workshops and now we know about this, but how do other people get this information? And one of the pastors said, we bring the information to our congregations, and then those people spread the word to others. So we're in the outreach that we're planning on doing to continue this work. We are going to be working directly with the community to have exactly the people in the community talk about the issues first. And then if they want to organize a town hall or something and bring us in, then we come in. But mainly, they are going to be the people transmitting the information in the way that is relevant, the language that's relevant to the community, with the same concerns. I'm a member of the community, I'm worried about this, what are you worried about? Yeah, so definitely.
Excellent. Cool. If there aren't any more burning questions, we'll move on to our next speaker, Dr. Wooten. Dr. Wooten is an assistant professor at Morgan State University, specializing in environmental health, community health and environmental health.
Yes.
All right.
I need a favor.
Yes, sir.
I need you to take a couple of photos.
Sure.
I need proof for my dean that I wasn't just out biking, that I was actually
On a Saturday?
doing some work. Yeah. So
You're not allowed to bike on Saturdays? Sure, yeah.
over here. Yeah. Okay. So you don't
You want
have
the
this
selfie,
one.
or?
There you go.
Got it.
Okay. All right. Thanks.
I'll
Thanks.
get your good side.
All right. Good. There is no good side. I just need proof. All right. All right. I'm very happy to be here. I'm very happy again to be here at Maryland and working with Dr. Wilson's outstanding team of students and graduate students and so forth. I have a warning though. You see, I'm a very nerdy scientist, and I'm an academician. I don't have a background in community activism and so forth, but due to my commitment to this particular issue in terms of research and its implications, I feel the need to kind of step outside of the nerdy laboratory academic environment or envelope and kind of get a little bit more involved because how prescient this particular issue is. So basically, this is going to be on the technique used to address a very serious problem, not just in Baltimore and urban areas in the United States, but worldwide, of lead contamination, urban lead contamination, particularly in soils. It's not, I don't know why it's not as known as it should be, but it is not just a problem in developed countries. Wherever there has been combustion, internal combustion engines, and the application of internal and external house paint, you have lead problems everywhere. Lagos, Nigeria, Johannesburg, Beijing, China, Karachi, Pakistan, it doesn't matter. As long as it's a large city with a reasonable amount of industrialization, there is a lead problem. The more inner city, further into the inner city, the more the problem is more pronounced. And those residents who reside in those areas are exposed to some very serious issues. So I'll just talk a bit about that and then make the connection between community activism, community involvement, community outreach, and so forth. So that's it. Okay, good. Well, that's the inspiration. Okay, that's the inspiration. Pure and simple. I mean, these outrageously cute little kids. Now, this is not far away from where I used to work. A couple of years ago, I was at Loyola University in Chicago, and I actually was going to do some research in this area. Sadly, now this housing development has been torn down, but it was built on top of a former lead smelting factory. And so these lead levels are outrageous. I mean, over 11,000 parts per million in the upper horizon, and then even in the lower horizon, there are 14,000 parts per million, which means there was a lot of dumping, there was a lot of industrial activity and so forth. And so the further down you go, this basically can't be fixed. So this has been torn down, the people have been relocated. But the problem is, these cute little kids' futures have been fixed. That's it, okay? That's the tragedy. And that is where I am inspired to engage in a lot of the activities that I'm engaged in presently. All right, so the questions, right? The questions, well, why is lead a problem? How significant is the lead problem as it relates to an urban environment, you see? And potentially what can be done about it? Because there are a lot of modalities to address the issue. But is there a cheap, sustainable solution to the problem, particularly when you're talking about working class and working poor communities, which are those communities that are disproportionately impacted by this contamination problem, you see? So why is lead a uniquely urban issue? Well, very simply, right? It's pervasive in urban areas because of its very high use value. Lead has a lot of, because of its particular chemical and physical properties, it can be used in a lot of things, right? But in highly populated, highly concentrated areas with a dense road infrastructure, it is the most number one, three sources of lead contamination in urban areas is automobile exhaust emissions, right? Over years, for the majority of time that humanity has been using internal combustion engines, most of that time, a no-knock agent was added to gasoline to keep the parts from sticking. One of the properties of lead is that it allows for free flow between metal objects. Old leaded paint from buildings prior to 1970, when generally it was outlawed. Mostly, though, this is for internal house paint, not necessarily external house paint. But the issue is that when older structures are are taken down and so forth, there's not necessarily a lot of attention in terms of the cleanup and dust issues and so forth, and the resulting deposition that stays. And then the concentrated industrial and manufacturing activity. Urban soils have very busy histories with a lot of activity. And many times, the lifespan of a given urban area, 50 years, like this area in East Chicago. Company went out of business, not a lot of records kept up and so forth, where the dumping occurred and so forth. A lot of it isn't known. Not a lot of due diligence is performed by the developers that want to build structures there and dwelling places. And so a lot of this information is lost. Therein, the history issue. All right, so why is it a health problem? Well, for me, this is enough. Okay, we're destroying future generations of people who unfortunately made the mistake of being born in poor conditions and contaminated conditions. It compromises the cognitive abilities of young children permanently. Okay, there are a whole lot of other issues, but this is the driver for me and for us at Morgan and for the School of Public Health. Because we see this issue again and again and again and again and again for not only, the issue is not just that young people who live in poor communities, but you see a lot of our students, a lot of our graduates and so forth have young brothers and sisters and so forth, and sometimes they themselves come from areas that have exposure issues. Okay, and there is an example of this quite graphically, as we'll see in a couple of minutes. All right, so what parameters are we dealing with, right? So as a nerdy scientist, you got to deal with some numbers, right? Because numbers add meaning to things, right? So ambient background or ambient levels of lead naturally are about 35 to 75 parts per million, depending upon the geology of a given area, right? EPA permissible limits on lead for gardening activities is 700 parts per million, but the UN World Health Organization is 100 parts per million. Well, for us, this is the gold standard. If we're going to engage in any kind of remediation activity and so forth, we want to get the numbers down as far as possible, okay? So we're not going to bother with the EPA. We're going with the World Health Organization in terms of our goals. Uh-oh, something happened. Am I right? No? Yes? Uh-oh. Oh, I should hit the arrow. Okay, good. Okay, see. All right, so there are solutions, okay, and there's several. And they are well known and they are engaged in, but you need a lot of money. Look at the kind of instrumentation it takes to address urban soil problems once it's discovered by removing the top 6 or 12 inches of soil horizon, which is usually where most soil resides, because once it's deposed, soil doesn't migrate very easily through the soil matrix. So it stays where it's deposed, and you take off the top 6, and then the next 6, and then keep testing, and see if you have a reduction, right? But it's very costly. So capping, evacuation, solidification, but all of these ways of solving the issue is to treat the soil with very toxic substances, or to actually remove the soil and then bury it someplace. Is that really so? What you're doing, you're taking the problem, and then introducing the problem someplace else where it's not addressed. Okay, and all of these, which again for environmental scientists is problematic because it destroys the biological integrity of the soil, and so you can't use it for purposes like gardening and that sort of thing. So one thing that we want to do, okay, good, is a technique called soil fixation or stabilization. A lot of different names, but technique is the same, right? What we want to do, we want to make the lead non-bioaccessible. Okay, we'll get into the particulars about what that means and what it doesn't mean. It will not be absorbed into the bloodstream if there's inadvertent ingestion. It will not be taken up by plant tissue. If you live in an area where you would like to garden and so forth, and there's an outstanding, a very wise movement in urban land deserts where people want to garden. It's a beautiful idea, but you have to be careful in cities because city soils have very, very busy histories. All right, so you got to test and so forth. And of course, in this type of technique, it maintains the biological integrity of soil so you can actually work with it. Right? So there are several compounds known in the scientific literature that work very well at sequestering lead so that you change its structure, you change its mineralogy. And, you know, there's an axiom in chemistry that says, you know, what is that? Structure determines function of a given compound, right? So you change the structure of a compound, you change mineralogy, then it will cycle differently, even if it is introduced into the bloodstream. So organic matter is known. There are several others, but organic matter is one of the very successful substances that can sequester lead, and one of the cheapest and one of the easiest for the working class and working poor to gain access to, you see. And a lot of people who engage in urban gardening know the value of substances like this because it's a good conditioner for soils, but lo and behold, it does other things, you see. All right, so, okay, so just how does it work? Don't panic. There won't be a quiz. It's just, but I'd like to give particulars about how things work and so forth. So immobilization mechanism for lead and organic matter is that they're bonded on the functional groups and functional molecules, right? So these carboxylic groups and the phenol groups that exist on the edges of organic matter are the main mechanisms and the main units, but there are many others. Again, depending upon the composition of a particular type of organic matter that you're dealing with, right? There's organic matter that derives from animals, and then there's organic matter that derives from plants, and so the composition of those are slightly different sometimes and so forth, and then you have a mix of these other types of groups that come into play. Whoops, so, no, backwards. Back. Uh-oh. What did I do? Hit it one more time. Okay, no. Oh boy.
You can't go back twice.
I'm here.
There you go. You got
That's
it.
it. Okay. 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 So we see. So I really like this. I didn't make this. Okay, so I stole it. But I really like this image. Again, I'm one of these people. You know, a picture's worth the saying, picture's worth 1,000 words. Sometimes picture's worth more than 1,000,000 words. You know, it concretizes the concepts many times for students and for people that you're trying to deal with. Well, so here, now this is biochar, but biochar is an organic substance. If you want to ask me what biochar is, we'll talk about it briefly. But here's a phenol group, right? Here's that ring, and here is the bond sites where these lead ions can be bonded to and attached and fixed so that they are not made available if it is made accidentally ingested, right? There are precipitation reactions and so forth, and cation exchange, and those sorts of reactions. But like we said before, catabolic and phenol functional groups really, by far, are the most numerous functional groups that lock up lead from organic material, okay? Organic material. And good, okay. So, well, where do we get abundant amounts of organic matter, particularly in a deciduous forest ecosystem like this? Senescence. Every autumn, senescence, mass senescence. Leaves for days, okay? All over the place, right? So it's there, it's free, it's abundant. The only cost is to go out there and pick it up, okay? And then do something with it. But they're everywhere. You're here in the east, from Mississippi, west of Mississippi, about 200 miles, all the way to the ocean. This is the deciduous forest ecosystem. All the way up past Maine, all the way down to Central Florida. Every autumn, we get this out the wazoo. Okay, this is an answer, people. It's an answer, okay? And we just had a little explanation about how it is done, you see. Okay, so the intent of a particular project is a project that I worked on last summer with some undergraduate students. I got a grant from the provost's office to kind of get the students involved. But the point of it was a practice run in how we're going to interact with community groups and kind of develop this taking charge of your life and reducing your exposure through your own activity. So, and us working with them. So the issue was to reduce the total volume of leaf litter, kind of remove the waste label off of leaf litter and see it as a resource in terms of soil conditioning, but also as a possible treatment for not just lead, but other toxic metals, right? And recycle it for beneficial purposes. Then we turn this waste into a valuable resource like we just talked about, and then provide this, we provide its valuable experience in the fundamentals of applied research. And it's not, I don't use kind of the terms, I don't want to sound that nerdy. We want to use this vehicle to engage the public, to show them how practical science is. Okay, I don't like this term that came about in a commercial that, you know, you can do this. It's not rocket science. Well, depending upon how you explain it and how you bring the concepts, through. Rocket science is not that difficult. You don't have to, go into the minutia of the equations and how you calculated the amount of fuel and so forth, and how to set your orbital trajectory and so forth. But you can organize your presentation to your specific audience, you see. And if you want to show off, well, you use a lot of multisyllabic terms and talk over people's heads. And of course, you just turn people off, right? But if you want to communicate with folk, well, then you use language that, anybody can understand. So this was a vehicle to try to work out how we're going to deal with this issue. So what did we do? We used actual residential urban soil samples. So we found a site in inner city Baltimore. And this was kind of tragic, really, because it had very high contamination levels. And then we actually went out to a site where we picked up our product, okay? You don't have to be a technician, a scientist, or an engineer to do these things, okay? So it was developing a model for how we take residents and kind of how we do these things. So the next few slides are kind of representative. Okay, so just to clear up something. There's lead and there's lead and there's lead, right? And so our issue is to sequester the lead. You understand? So there is total lead and there is that other portion of lead. So total lead, all lead in a given soil is not a danger, right? It is that portion that can be taken up, that is bioaccessible, that is water soluble, that is fat soluble, right? Depending upon what the kind of other compounds that it is bonded to that can enter into bloodstream and then do its pernicious damage. But all of it is not an issue. So you have a contamination issue with like 1,000 ppm. Well, 1,000 ppm of total lead is not, all of that concentration is not going to be a problem. So you have to do some additional wet chemistry analysis to shake out that portion that is bioavailable, you see. Oh, okay. All right, so this is where we collected it, okay? Is that inner city or is that inner city? All right? Okay, so you see, this is Sandtown in Baltimore. This is an active residential community. There were kids on the other side playing football and wrestling and doing kid stuff. And so we collected soil from that site, very high concentrations, I'll show you. Now, the cure. Well, we saw a leaf pile and we took off the top leaf layers and dug down until we saw some growth of fungi, and then we knew that there was a certain amount of breakdown or decomposition that occurred, and then we took that up. Okay, so where we got is on the northern end of Morgan's campus. So it's not that deep, right? It was this northern end of Morgan's campus where the grounds people kind of dump the leaves and they take them off of the campus and so forth. We just dump them up there, and then we kind of dug down and see what we could do with it. I'm not going to go into those issues. This was the application rates doubled so that we could shake out differences between the treatments. And this is what we had to do to determine bioaccessibility. So there's total, and then there's bioaccessible. So you understand the difference between the two. Not going to go into all of that, although one important thing is make sure that the treatment is not adding to the problem. So this lead, we make sure that it is at least below 100. It's not adding to the problem. But this is total, okay? So that's very high for little kids, the cute little kids that were playing football and wrestling, all right? All right, so it worked. It worked. Okay, so this is total, no treatment. Low rate at 10%. We reduced it by 28%, and high rate treatment, a doubling. We decreased that by just under 38%. So it worked. But, okay, so the question is, well, how much more treatment is needed to kick it down below, at or well below this UN standard? That's our issue. All right, so herein is something that's new to me. This is the community engagement, activism, and so forth, and that is the Be More Lead Free initiative. And our attitude is we have to take the science to the people. Okay, we have to. We have to take the science. We got to sometimes come out of the lab as comfortable as I am in the lab, as serene as being in the lab is for me. You got to come out of there sometimes and relay the information, right? So it originated from students in a course that my colleague, Dr. Brown, and I teach at the School of Community Health. And this was inspired by the tragic death of Freddie Gray and those issues. And so that was the catalyst, and really it was pushed by the students. Pushed by the students. Dr. Wooten, Dr. Brown, what can we do? What can our knowledge base do to positively impact people who are exposed to these things? And it is their pressure upon us to come up with ways to do this. Okay, so Black science matters, okay? In a majority African city like Baltimore or DC. Well, DC is not African majority anymore, but you get my point. People who have been marginalized, people who have been made susceptible. You have to develop, like my colleague said, trust relationships. And so in this, we're working with groups and developing long-term relationships with communities, community groups, church organizations, child welfare groups, and concerned citizens and most impacted areas. And I want to show you, this is where Sandtown is. Okay? Off the charts. and a lot of these other areas. These are, but not as high, but still very high. And this denotes the urban nature of the lead contamination. And you got to come out of the lab. Okay, this is us at Harlem Park, near Harlem Park Elementary School, and there's a community garden close by there. And we did a lot of readings with an XRF, which is an electronic device that gives us total lead numbers. And of course, then we take plugs and we take them to the lab and analyze for bioaccessible, right? And so these are our students, very bright, proud people. And then we took readings for some lead paint in some abandoned buildings. Crazy, absolutely crazy, insane numbers. And we could trace from the high levels of the lead in the paint, and then as it went down in the soil, took numbers in soil at different intervals, all the way to the alley, and it was obvious where the lead was coming from in the soils. Like the lead paint levels were like 800. Soil just adjacent was 650, then 580, then 420, and then by the alley was like 3. That's all still too high. All of it's too high, okay? So again, you know, this is demonstrations that a lot of times I've never been out in the field as much as I have been at Morgan. And it's quite refreshing actually, because guys on the street corner and so forth, people hanging up, cute little kids, they come, hey man, what y'all doing? Tell us what you're doing, you know. And but the thing is, so you know, this thing about taking science to people, it's not above the people's heads. It's not. Okay, it's your attitude and how you present this information, right? And so these numbers, the graphs, even the techniques, when we engage with community groups and sit down with them to show them what exactly you can do, we'll answer all the questions. And the most important thing is to provide them an answer to their particular problem by involving them in this process. All right, so, okay, so that's that. So, yeah, if you have any questions.
Do 2 burning questions.
2 questions? Here. Hi.
Yeah, hi, thank you for your presentation.
Thanks.
It's
my pleasure.
Exciting.
Thanks.
My question, I guess, is two-part. One, I believe there's research that lead, higher concentrations of lead also lead to levels of aggression in children.
Yeah.
Perhaps adults as well. I don't
Yes.
know that research as much. But I'm curious if you know about the Philadelphia project with the Philadelphia Horticultural Society, where they've gone around and greened vacant lots, cleaned up vacant lots. They do sometimes with vacant housing as well. And they just clean up the lot, put down grass, couple trees, put a fence around it, and they found through a randomized controlled trial, they've actually found a reduction in gun violence as well as an improvement in levels of depression. However, my concern, thinking about it and seeing the picture of the cute kids playing on the lawn, is now that this vacant lot has a lawn for people to play on, rather than like,
Yeah.
trash and condos and
Yeah. Yeah.
So I'm just curious what you think about that and what the trade-offs might be. Curious for your thoughts.
Well, that's a very good question. It's a very good question. And it's very interesting that you asked that, because we developed a relationship with the Park Heights Renaissance Community Group in inner city Baltimore that trying to redevelop that particular area. Low income, abandoned housing, all kinds of problems that you have with very poor, working poor people in enclosed and desperate conditions. But one of the things that we want to do, and they have been asking us to figure out, working with them, what we can do. So they have abandoned lots. We're going to go in and take readings, take plugs, and see what the nature of the issue is. And but you see, there are some treatments. Right? There are some cheap inexpensive materials that can work and they can work long term. So part of the research, okay, so this is the nerdy academic piece about, generating papers and new knowledge and so forth, and then getting grants, is working with different materials, combinations of different materials, so we can create some kind of synergy with mixed materials at different concentrations that will sequester lead over long periods of time. Because like organic matter, for a pretty substantial period of time, organic matter locks up lead. But like all organic materials, no matter how effective it is, over time, they will break down. So even in organic material, cellulose, hemicellulose, lignin, and all those very resistive compounds or tissues that resist decomposition over time, talk about count years and decades, they will break down. So you mix in. So the research is mixing it with inorganic materials that will not break down and that will lock up lead, even if there is release or re-release of lead by the broken down organic materials. So there's, again, one has to be creative. You can't take one treatment and think it's gonna fix everything. But again, this is the learning piece. You see, this is the student piece, this is the nerdy professor piece, and finding answers by playing with the issue. And so John Madden was my favorite sportscaster because he always gave a scientific answer to the question, who's going to win the Super Bowl? And he said, well, I don't know who's going to win the Super Bowl. That's why they play the game. Mm-hmm. So, what is the success? How do we do this? Well, we don't know. That's why we do the experiment. Okay? So we have to figure it out. We have to generate some data, and then on top of the previous study, then we study some more things and try to figure out what kind of trends are going. But it's very interesting. I haven't heard of that particular project, but it's a very similar thing, a very similar relationship that we engage in with this hardworking group of people in Park Heights, and a lot of abandoned sites. They want to green things, they want gardens, they want parks to sit, they want some performance areas and so forth. But the thing is, there's a lot of things you can do. This is the thing as a scientist that really, in environmental science, that annoys me to no end, is you see a lot of publicity about, the lead problem and so forth. Oh man, the government doesn't do this. Oh man, we have some serious problems. Look, there's something that we can do. My father used to say this to my brother and me when we were young boys. We were scared of the dark. And my father used to get annoyed. He said, look, boy, stop whining about how dark the room is. Turn the damn light on. Okay, so, you know what I mean? Find a solution, okay? You don't have to accept being ignored, being neglected, okay? We here at Morgan, our existence is, we were created to address the problems of the African community on a lot of different levels. So this is our charge, okay? Okay. Oh, so one more question, and then I'm going to get shot if I keep going.
More like a comment. I'm familiar with Lawrence's work on the Black Butterfly.
Oh, yeah.
And so, I think about a year ago, someone started to tie lead to the violence in Chicago. Addressing almost what the young lady said right there. And so in Baltimore, the state of Maryland, the governor has gone through a whole process over the last year of demo strategy in Baltimore.
Yes.
And I don't think is anybody. I don't know if they even gone back and did any remediation on those blocks. Yeah. Those buildings have been demolished, knowing that they were all pre-70, all lead contaminated, and getting back to the issue you're talking about, from the building to the ground, back to the back alley. Right. So I'm really concerned that in Baltimore, where all this demolition is taking place for all the low-income Black neighborhoods,
right?
What are we looking in terms of, again, an issue that's violently tied to race? I
agree. That's the history of America.
Yeah.
The history of America is what? Genocide and the torture of Africans dragged over here, and the constant disrespect and emotional torture subsequent. There have been attempts to address that, but look who's in the White House. You know, I mean, America has some very serious problems, and they have not gone away, and sometimes they get worse in times that they're supposed to get better. But you don't have to keep whining about the larger community and how they don't care. If we care, we address it. So for anybody who's interested in remediation and sequestration and anything else, I have a bunch of cards, and we can, you know, we can address it, and we take samples, and we'll do it. So please, okay? It's cool. Thanks.
So, bringing us home is Mr. Omega Wilson. Thank you, Dr. Caldas.
Sorry, I have a plane to catch before, it doesn't matter. But that was not planned. I'm sorry, Omega, I'm gonna miss your presentation.
We got behind. Thank you so much.
While he's sitting up, I have a handout. Hopefully there's enough copies that it connects to my PowerPoint, if you don't mind.
Oh, here it is.
Right.
You guys could have told me.
Passing those out.
All right. So Mr. Omega Wilson, and it comes to us from Mebane, North Carolina, Alamance County. West End Revitalization Association is his baby. Just celebrated 25 years last year, working in the community with this organization that he brought up along with his colleagues. And so I'll let him take the floor and talk about all the great work that's been going on in community engagement in
And
Mebane.
I'm pushing Eric Key up and down.
Left, right.
Okay, left, right, okay. All right, thank you. There's a couple of things. Before I talk about the guinea pig syndrome, there's a handout that's going around, and it's a case study about some of the work we've done. And some of the information in this PowerPoint presentation is a pretty chastising rebuke of some of our relationship with some colleges and universities and partnerships with community organizations. But I got a deacon over here, maybe associate pastor. Over the last 25 years, some of that history comes out of our civil rights work. I'm 69 years old, so civil rights work has been life. So I'll just put a pin in that. So some of it comes out of that relationship. But the handout talks about something that the National Institute of Environmental Health Sciences asked us to do in association with Dr. Jacoby Wilson, who, you know, is the person who's facilitating this, because I knew Dr. Jacoby Wilson. He was one of the student proteges that came to us when he was working on his master's degree 20 years ago and became a community partner with us. And some years after that, 8 years after that, when he had finished up his master's and PhD work, he continues to work with us, and it's been 20 years now, almost 20 years, 19 plus years. We received a grant to evaluate some of the community-owned and research model science work we were doing in our community. And we came up with our own name for it. And community-owned and managed research means exactly that. And that was our model. It was directed from the community. But anyhow, the National Institute of Environmental Health Sciences, I think everybody in the room is probably familiar with who they are, decided to take an analytical approach of what we were doing. They didn't fund our work. They just wanted to look at what we were doing and see, because they'd heard something about us, and they were just kind of curious if we knew anything about what in the world, what in the hell you're doing. So that was in 2008, and they gave us a mini grant, $100,000. $50,000 went to the University of South Carolina, where Dr. Jacoby was after he did his postdoc fellowship out of the University of Michigan. And $50,000 went to the community organization to analyze what we had been doing for several years. And it went on for about a couple of years. But in any case, what happened, the National Institute of Environmental Health Sciences contacted us several years later in 2015 and said, we've been evaluating 250-some community groups we funded over the last several decades, 250-some community groups. And we've called out 24 of them based on cutting edge work that they've done relative not to just collecting data and creating what we refer to as dusty papers or papers and documents that create opportunities for people to finish their PhDs without doing anything in the community, or for professors to get tenure without doing anything for people in the community, or departments collecting millions and millions of dollars every quarter or every semester, researching us without any plan to come up with solutions. When they got through, they identified us as, out of 24 they selected and identified as national citizen science models. And what are you talking about? They identified us as number 2. We were probably the smallest group out of the initial 250 something. Then what they wanted to do was take a look at our solutions model. And the handout on the first page talked about some of the things we talked about in our principles, the case that I just gave you. And our principles had to do with, the first thing is doing the basic structure of how you address a problem. The first principle is solving it, just like CSI, NCSI, or the old Perry Mason. Nobody's old enough to remember what Perry Mason is except me, probably, right? But the first thing is the show comes on in the first 5 minutes, just like Law and Order, is you want to find the crook, you want to find who's responsible, and do due diligence. That was our first premise, not to collect data, not to get John out of graduate school, not to get tenure for Dr. Wooten. No offense meant to either one of you. Our first premise is to find out who did it and correct the problem. And who did it, the victim is the community, right? That was our approach. Principle 1, funding equity. Fund the community in an equal basis that you fund the university. The other one is management parity. The management parity means the process will be managed from beginning to end by the community, with the community leading you to where they want you to go. So you don't get stranded and preoccupied with scientific data just because it's cute, right? We want you to go to the right places in the community to solve the problem, not the fancy places that you want to go to just because you've never been to this community before, or because you want to shake hands with the mayor, or whatever the case may be. The other one is this whole question of science for compliance. That's a term we raised and used to narrow down the discussion. Science for compliance meant that we want you to look at the science specifically related to complying with current existing laws and statutes. And we took those statutes to the federal level. Whatever the Clean Air Act is, whatever the Safe Drinking Water Act is, whatever the Clean Water Act is, whatever the Toxic Substance Release Act, all landfills, et cetera, diesel emission standards, we want that data to be collected based on those standards. And we found repeatedly Duke University, University of North Carolina, Chapel Hill, et cetera, graduate students were being sent to us to collect data with no margins or no measures or no parameters. They want to collect data to make beautiful pie charts. They look wonderful. And bar graphs and some flowery data. And our names were out of it. All we were is a bar graph. Nobody knows where the hell they got the information except the name of the community, the name of the city. We were no longer identified. So you can't do that and identify and solve the problem with somebody who is victimized. You had to know who the victim is, where they live, what street they live on, they male, female, how old they are, etc. You just do the CSI. It's pretty easy, right? The other part was taking that data to leverage compliance and enforcement based on existing and current laws. That's what the National Institute of Environmental Science said, wow, you did something that we haven't been doing. We've been spending billions of dollars every year and we haven't been doing our job. As a result of all of that, 2 years ago, they asked us to be a part of planning the National Citizen Science Association's conference, National International. It was held this past March the 13th through the 17th in Raleigh, North Carolina, with 800 people from all over the world. We were asked, my wife and I, who's here, Brenda Wilson, we were asked to be a part of a small group that invited people of color, all colors, Vietnamese, African American, Native Americans, mixed race, LGBTQ community people from all over the country, from Hawaii to Puerto Rico, to integrate the citizen science at the national level. We were funded to bring that. Over 50 people, about 55 people from various ethnic backgrounds, from little cities to small communities like ours, from Detroit-led community to Hawaii, et cetera, to Raleigh Convention Center, to help integrate a high academic culture. And the reason they wanted us there, they knew we would fight through the minutia because a lot of communities wouldn't do it. A lot of communities didn't want to stand by and be beat up by academics that just didn't respect them being in the room. And my wife and I got beat up a lot, but they knew we would stay. They knew we were hard hit. We had our helmets and our gear on, and we stayed because we had done it before over and over and over again. But in any case, the texture came out of this PowerPoint presentation, and the PowerPoint is moving by itself.
Yeah, I think it's advancing on its own. I wasn't sure if that was your design or not.
All right. But in any case, what had happened some years ago, there were some specialists from the National Institute of Environmental Health Sciences at the Research Triangle Park in North Carolina. I know a lot of you have been there, I guess, and they wanted us to talk to scientists, high-level scientists, about how they treated communities. And this is several years ago, so I do the PowerPoint presentation with Dr. Steve Wing. Some of you know he passed away, who was a very good friend of mine. We partnered, and I did this presentation from the community side about the guinea pig syndrome. It's been reduced and modified since then. It had to do with how communities were treated in Mebane. And we weren't going to tell somebody else's story. We told our story. But we were called there by some chief researchers from EPA and the National Institute of Environmental Health Sciences to talk to their scientists who would not listen to them. It's interesting. You don't want to listen to your boss, so you bring somebody from the outside. You bring the victim in to kind of beat them up a little bit. And they were supposed to have like a couple of dozen people who went with a room full of people who wanted to hear. But in any case, what we wanted to do is start talking about this issue and bring it to a bigger level. Because a lot of researchers and universities wind up coming collecting data from the community. And what does the community wind up getting out of it? A Walmart card to participate. If you get a $50 one, it's good, right? $25 is average. I've talked to people in our community and our adjoining neighborhoods who are professors from major universities in the state of North Carolina who bought them cold cheese biscuits from McDonald's to encourage them to do research with them for a $1 million or $2 million grant application. I mean, if that's third world, I mean, that's worse than third world. These are reputable institutions. And by the way, they're not only white, they're not only black, they're women and other people of color too. They're Asian, right? Who are mistreating other people of color, right? We had people come to our community wanting to test the wells because we had problems in our wells with contamination from old chemical that was put there by manufacturing concerns, furniture companies, benzene, xylenes that is soaked in the ground over almost 100 years, where we had to force the state to drill down to do the test wells, some 40-some feet, like 3, 4 stories, almost 5 stories down to see how long this stuff and how far it's soaked in. And of course, some of the test wells with the chemicals we found in the wells could not be charted because we were looking for fecal coliform and things of that sort, which is different. That's biological. But some of the stuff is not biological. Benzene is not necessarily a biological chemical like an organism is. So you have to have different parameters for doing all the tests. But one of the things we found is that some of the university professors traded our names with other university professors. So we wound up with all these people coming to our community. Well, we want to swab your mouth and see if you have this kind of disease. Can you get some people to stick this in their noses? And we need 50 samples. We won't bring you some cameras and want you to take pictures of what's happening in the community, where the dirt and pollution and sick people are. Oh, by the way, we have another group of students working on their PhDs, and they want fecal matter. Can you use some fecal matter for us? What the hell? Who? Oh, by the way, we have another professor who's getting ready to do a major study. He's working on $3 million to talk about tobacco effects because North Carolina's a tobacco state, and we want you to collect, butts from people who smoke in your communities. I don't mean butts, I mean butts. Right? I'm saying it's just like, what? You're a grown human being, you got a PhD, but you have no damn common sense and no decency and no morality. So we went through all of that. But in any case, the model, we had already been doing this, but we hadn't called it a name. We hadn't given it a name. So Johns Hopkins University, in association with Chris Haney, who's a professor at Johns Hopkins now, was one of the students. Dr. Jacoby Wilson was one of the students. Dr. John Cooper, who's now associate professor at Texas A&M. All these were graduate students eating gummy bears and nachos, coming to our community saying, yeah, we are learning more from our college professors at Carolina School of Public Health than we're learning in class. We're learning more from you, right? But in any case, they wanted to write some articles on us. We submitted articles, and they were going to publish one, but they wound up publishing 4 and a podcast, and sending us to Canada to talk about our story. Dr. Wilson and I went to Canada, and they paid for the whole thing plus, to talk about how university people are not respecting the people that they research. We did the relationship between the universities is called collaborative problem solving, where we select a university professors, not the professor selecting us. So we fired university professors. You come and want to talk to us, we check them out. We do our Vita and check them out and talk to other communities. If we don't like them, we don't like how you treat us. My father would go fishing with my dad, and we catch a fish. He said, nah, not good, throw him back. So that's what we did to some professors. And some professors would come to our office and just demand. They would lose composure. They would get street and demand, you cannot treat me this way. You cannot disinvite me to your annual dinner. And I said, hey, tell you what, talk to our lawyer. So we learned how to take that leverage and pick the people we wanted and leverage it. That's the reason how we found some success with the work we're doing. This whole question of relationships between community has to grow and develop. Dr. Jacoby Wilson, I have to say, and Dr. Chris Haney and Dr. John Cooper, and there's some others, Dr. Daniel Purefoy, and Dr. Dara Hall at Mendez at University of Pittsburgh. All of those people were students who came to us, just like Jan, when they were in school, and they kind of learned from us 15, 20 years now, and some in between, and said, oh, wow, we learned something. We learned respect, we learned appreciation, we learned love. It's sharing, it's a mutual thing. We do tag team presentations with the professors. They're professors now, associate professors. We've done them from coast to coast over the last 15 years or so, like we're doing here, right? So we want people to understand on the community side that you have leverage and respect if you demand it, and you have a model for making it work. This particular model, community-owned and managed research, was a feature piece that was presented along with the guinea pig syndrome at the Citizen Science National and International Conference just past March, because they wanted to hear about it too. They wanted us to present it in a panel with the ethics board for the National Science Foundation. They wanted us to talk to the National Science Foundation because guess who they fund? They fund you. And we were brought in to be the ethics police as a community spokesperson. And we're still in communication with them and sharing that information to encourage them to understand what they need to do proactively so they can share the information with their colleagues, not only on the research side, but on the funding side too. So it's grown to a national and international audience. It's taken a while, but it's grown. So that's what I'd like to share with you. And if you don't pass the test, there's no admittance. You have to pass the test. You have to pass the community test. We're teaching other communities too, to leverage. It's your life, it's your community, it's your problem, and you want to solve. And if you're not coming to solve the problem, then you're part of the problem. That's an old street term, right? Right? And we don't want you here. So we put them out, and it has nothing to do with color. We put out black professors, we put out vice provosts, we put out deans, we put out a lot of folks. And a few people that didn't want to go, we call a lawyer, said, talk to the lawyer. The lawyer will talk to you and tell you not to step in this office again. Don't come to this dinner again, or we'll talk to you in court. It's been that serious, okay? Thank you.
Well, we have, let's see, I'm sure you heard, there might be some dismissal going on. We're gonna take a 10, let's see, if we're at 5:10 now, we can take however you guys, reception's good to go if you're fiending for some food. Otherwise, you can eat this knowledge dish.
Well, I just have a comment, and your presentation is really encouraging, because this is an area that has been frustrating for me, and but I like to see the attitude of powers. You know how you're taking your destiny into your own hands. You don't act like victims. You know, you want a problem addressed. You want it, and you seek out people who can address the problem and to maintain and force them to appreciate. You are not objects of research. You're subjects of research that are working with investigators. And this is the kind of mentality that we want to work to build in the communities that we're working with. You know, don't just keep whining about how our kids are being impacted by lead, right? There are ways and means that you can address your issue very effectively. But this whole attitude that, look, you're gonna work with us the way we want you to work with us, okay? And I really commend that whole attitude.
Thank you.
Absolutely. Audience questions.
Questions.
One and
So,
two.
thank you for all the panelists. I'm humbled by your talk. My background is in environmental health sciences, and I can appreciate your talk too, because I was a chemistry major, and I just loved all those functional groups. I was like, oh my gosh. And I graduated from Oregon as a chemistry major. But what I'm doing now is, after being in the lab for so many years, this is my first time at this conference. I know Jacoby just a little bit, but just hearing him, I knew that some of his passion was going to be put forth, and I would hear from different people like yourself. And so I so appreciate what you're saying, because while, again, coming out the lab, I'm trying to develop a community academic partnership in Baltimore. But first I'm listening, because I don't want to, say anything, because I know that my colleagues, I'm built on all this distrust. So I guess I appreciate your information of what you're saying in terms of scientists. And my quick question is, so I'm working on a budget right now, and I love what you had said about, the $25 gift card. Would you say the best approach to, say, a budget from NIH to make it fairly equitable is half for the researcher, half for the community? Is that the kind of budgets that you've worked with?
Yes, we've done that, half for the research, half for the community. That's what we did to analyze our project with EJS. We just split it down the middle to save any argument. And of course, Dr. Jacoby Wilson was a friend of ours, so that wasn't a problem with him.
Okay.
In other communities, in other lectures I've done like this, I've had professors raise their hand and say it should be 60-40 for the community. I'm saying, and then others say no. We have overhead, so it should stay 94% for the university and 8% for the community. I'm saying it's all over the board as to what. And other grants we have received that came directly to us, we shared the money. So the expenses, the travel, the hotel, for Dr. Wilson and Dr. Haney, we paid them. When we travel, we paid their hotel bill from the community. And I said, whoa, because we got the grant money. So I'm saying it just depends on how it's working. Other parts of it is leverage funding. A lot of times when we are invited to activities like this as community people, you don't even think about paying them an honorarium. But the person that's on the panel right beside them, like Dr. Wooten or somebody else, it's no problem for them to get $1,000, to speak for 15 minutes. But you don't expect the community people, right?
You gonna help me out, man?
I'm saying that should be level with the community, not only their travel, their hotel, but their time and energy too. Because most often, if you're here as a professional person, as a medical provider or a researcher, you're on the clock in there, you're gonna be paid anyhow, you're already being paid, and you get a little extra. But the community people have to leave a job,
Right, right.
or if they have no job, they gotta find a way to take care of a babysitter and a whole lot of expenses. So they actually create expenses for themselves by coming here, and the other part of it is a social structure, where a lot of community people at the local level says, why in the hell are you in Maryland? We got problems in Mebane, North Carolina. What are you doing there telling them what we need? What are you telling our secrets anyhow? I mean, there's this social thing that you have to deal with. We're not getting anything out of the people in Maryland. They're not coming to help us. So you have to do the explaining.
Right.
You have to create, get people to understand the structure, because if they don't see any value coming back to the community, people like me or like my wife who are leaving town a lot, and we've been to Harvard, we've been to Yale, we've been to Johns Hopkins, Duke University, a whole bunch of places. They begin to draw back and they don't want to cooperate, even when you bring somebody to do research that you think is a good person, right? A good partner. Community people do what I want to even cooperate with me or the leaders of that community if you don't develop something where you can show we're bringing something back to the community. I mean, it's like the hunter and gatherer thing. You've been out hunting for 9 days, you don't even have a rabbit. You're looking for deer, you don't even have a couple of fish. I mean, what were you doing out there? I'm saying, I'm putting it in a simplistic term, and that's the community needing to survive, needing to stay alive. I have met groups like ours who have been involved in grant applications of $500,000, and it was supposed to be even. And when the university got the money, because they were the major PI, they said, okay, here's $40,000 for you, you get 10%. Who blew the whole grant up. I've met community groups who do that, who contacted the funder and said, kill it. They cheated us, they robbed, they stole from us, and they killed the entire grant. I mean, just kill it. So, you go from one extreme to the other.
I really appreciate that. I want to give two things going on. So I want to give everyone enough time to get downstairs and get food, but also we're doing another raffle down there. So I encourage everyone here to walk with Dr. Wooten and with Mr. Wilson here, talk with him, maybe sit at the same table if you want to learn more. Also, just to clear the air, none of the panelists were paid. This is a free conference. We're greatly indebted to our sponsors, and we really appreciate it. And by that same coin, thank you so much for joining us and agreeing to share your stories.